Impact of long-term sickness on UK workforce. 1.6 million over 50 unable to work. A recent study highlights the dire state of the United Kingdom's healthcare system, with more than 1.6 million people aged 50 and over unable to work due to long-term sickness. The number has increased by 20%, or 270,000, in just 3 years. The report cites figures from the Office for National Statistics, as reported by Restless, a digital community and advocate for people over 50. According to Stuart Lewis, CEO of Restless, not only is this a national health issue with thousands of people suffering silently, but it's increasingly an economic issue too, not least because many of these people would like to work in some capacity, if the right opportunities were available to them. The data reveals that nearly 60% of the 2.8 million people currently out of work due to long-term sickness are aged 50 and above, with a total of 40% of economically inactive 50 to 64-year-olds out of work for the same reason. The COVID-19 pandemic has significantly reduced the size of the country's workforce across all ages, but it has had a particularly large impact on the reduction of available workers in their 50s and 60s. The number of 50 to 64-year-olds economically inactive, neither working nor looking for a job, has increased by 375,000 since the start of the pandemic. In total, 27.6% of people in this age group are inactive, marking an increase of 2.4 percentage points since the period before the pandemic, significantly more than the 1.5 percentage point rise in the working age population as a whole. B. Boileau, a research economist at the Institute for Fiscal Studies, described the findings as troubling and added, "This rise in long-term sickness for economically inactive people is very concerning. It adds to growing evidence that the UK's health is worsening." The UK's publicly funded National Health Service, NHS, has struggled to cope with demand since the coronavirus pandemic, with waiting lists for operations reaching a record 7.2 million people in England in October. Specialist advisor at the Centre for Aging Better charity, Kim Chaplin, says the statistics make clear that long-term sickness is part of the challenge that the government needs to find solutions to. She asserts, among the thousands highlighted, many are currently stuck within, or outside, an employment support system that does not work for them. In recent months, the UK has been grappling with its largest industrial action in decades, with nurses and ambulance workers walking off their jobs to demand higher pay and better working conditions. In conclusion, the rise in long-term sickness among the over 50s in the UK is a concerning issue that needs to be addressed by the government. The impact on the country's workforce and economy cannot be ignored, and solutions need to be found to support those affected and help them back into the workforce, if they so desire.